Hello, and welcome to another episode of Your Public Health Professional and You, a program of the Maryland Public Health Association. I am Lillian Agbeyegbe, your friendly community health educator and your host for this program. As you know, we began Your Public Health Professional and You talking to members of the Maryland Public Health Association. We know, though, that not all public health practitioners are members of the Maryland Public Health Association, so we've expanded our conversations to other public health professionals that are not members of the association. Today, I'm very excited because today is many firsts for me. It's the first time that my guest is somebody that went to the same institution with me. It's the first time that I'm talking to somebody that is an MD and an MPH. And I'm sure you're saying, because I said that the first time I said MD, MPH, what is that? You'll get to find out. Stay tuned. Let me introduce my guest for you today, Dr. Ugo Uzoeghelu. Dr. Ugo, you're welcome to Your Public Health Professional and You.
Thank you. Thank you so much for having me. Like I said before, this is an incredible platform, and I'm so lucky to be on this platform today to talk about everything about public health and medical practice.
Awesome. So you started, as I was doing my research for this interview, I saw that the number of applicants for the MD, MPH dual program has been on the increase in recent years, but that's not how you started there. You had your traditional MD and then you went to do an MP. So tell us, how did you get to your MD journey in the first place? Did you always know you wanted to be a medical doctor growing up?
I know. No, interestingly, that was not the plan. So I come from a very big family. I'm the last of 6, and all my siblings went into accounting and finance. But for me, I was also thinking of going into finance with them. But I remember my granddad, he was admitted in the hospital. He had surgery on his knee. So I think I was about 10, 11. My sister and I, we went to visit him in the hospital. And that was a teaching hospital back then. So after we visited with Grandpa, we were playing around the hospital. And then we kind of went into this area of the hospital called the medical ward. And in the medical ward is a room actually separated from the entire ward called the HIV death row. So that means these are people who are living with HIV, like end-stage HIV. And they were so isolated. People didn't want anything to do with them. You rarely see nurses and doctors around there. And these are people who are like near death. And I began to ask myself, why are we here? What is really going on here? And just having that conversation with people around me, even with my sister, I eventually learned that these are people who are just waiting to die. And thinking about it, I'm like, why do they have to wait to die? What is happening here? How could have been prevented? So that curiosity and that questioning led me into science, and eventually led me into medicine, really to be able to be in the front line to provide medical care to people who need it, in a way that is decent, in a way that is honorable, and in a way that is human. Because what I saw in those years was very traumatizing to me. I really wanted to change the narrative about providing healthcare services.
Awesome. I mean, and that is so incredible. And it reminds me of my own journey also. I worked on the field of HIV/AIDS, and yes, this was when we were both in Nigeria. Your story was when you were in Nigeria. I started working in the field of HIV/AIDS in Nigeria, and I worked in the Niger Delta area. And I remember when I went to the general hospital in the city where I was working, and I was trying to get some HIV test kits for the doctors, and they were really not a fan of test kits. They were just like, we test so that we know that we should stop, sort of like, quote unquote, wasting our time. It's like, we're trying to heal it, and this person has HIV, it's a terminal disease, and then you're like, seriously? I thought the reason of testing was so that you could get it. They're like, we don't have, then they said they didn't have drugs, they didn't have anything, so there's nothing they could do. And I know our office driver at that time used to look at us like, I don't know what I want to be driving you around if you're going around these people. So that must have been some experience. So you've come a long way from then, because that was when you were in Nigeria, and then you went on to medical school in Nigeria, correct?
Yes, I know I've come such a long way from there. And again, keep in mind, even to your story, back then HIV was like a big deal. You have to see the discrimination, the stigma associated with living with HIV. People just didn't want to deal with you. People didn't want to touch you. Even families were not even in contact with their loved ones who were on admission or who had HIV. So it was really the trigger for me to get into medical school. But graduating with MD was not just something I want to settle with. Again, because as an MD, your approach is very individualistic. You provide a very tailored care to your individual. You diagnose, you treat. But I wasn't comfortable with that. I wanted to do something that is community-based, population-based. How do we educate people at community level to prevent these things from happening in the first place? I don't want them to come to see me when they are down with the illnesses. How can we teach them at community level to prevent these diseases, right? That was what drove me into public health. And, thinking about the differences between public health and MD is that, as an MD, you're trained to diagnose and to treat, individualistic approach to care. As public health practitioner, your intention is to advance and to promote public health practices and promote the health of communities and populations, right? So your approach is not just through the lens of an individual, but through community lens. So again, that was what led me into what I'm doing today. And I mean, I couldn't tell you, it's been awesome ever since.
Awesome. I really like that. And you started to break down for us the difference in MD, that is medical care health, and public health practitioner. Because I tell people that your MD is only concerned about you when you present yourself to them.
Right.
There and you show up, and their concern is how do they address the issue that you're presenting with them. But your public health practitioner is looking at you before you even have to see an MD. So one of my favorite examples is you go to the healthcare provider and you need a blood transfusion. Yes, somebody in the hospital is going to give you the blood transfusion, but the hospital doesn't manufacture blood. Somebody had to donate the blood.
Right.
Who does the blood drive? Who promotes the blood drive? Who can ask for volunteer for the product? Those are your public health practitioners. That's your health educator saying to people, hey, we need blood, saying there's a shortage, planning it and saying, okay, which time works best for people to donate blood? Where can we have the blood drive? Should we have it in church? Should we have it at the workplace? Should we have it, should we have it during the day? Should we have it during the night? Should we provide incentives? How do we do it? Do we need to have it in different languages? That is your public health practitioner doing all of these things. So the difference between your medical care. Now, if you can give us, because we want to really humanize public health for members of the public who are like, I don't see you. What do you mean you work for me? So how are you working for a member of the public that you would never meet as a public health practitioner in your work?
I know. I mean, sometimes we are invisible in the work that we do. And I say this because just like what you're saying, I think before I say what I want to say, let me give an example. So I have a close friend of mine who in 2022 got his MPH in epidemiology. And I remember we had a conversation and he told me when he went into grad school, his dad actually was like, why are you going to school for MPH? What is epidemiology, right? So, and because of that, his dad actually didn't help support pay his tuition and all that. He had to get a loan, even though his dad was very capable of doing so. But fast forward 2 years later, COVID-19 happened, and his dad was actually admitted in the hospital, with COVID-19, isolated, with no family members. And I remember when he talked to him on the phone, since his diagnosis, The first thing he told his dad, this is public health. You know?
Really?
You know, and I think COVID-19 really kind of put us in the front line. People who are not aware of what we do as public health practitioners are now beginning to pay attention. The enrollment into public health programs has increased since the pandemic. Most MDs now are interested in getting a MPH degree. It's like passage of honor these days for an MD, you know, to have an MPH, because it fortifies you as a provider to be able to do the clinical part, but at the same time provide that prevention piece to it. So a lot of people see you as a complete healthcare practitioner. But again, to your question about the work that I do, you know, I don't know if I discussed with you, you know, in the past about what I do now. So right now, I'm an HIV field epidemiologist. So that means we help support case follow-up, case investigations, and linkage to care services for our residents, you know, who are diagnosed with HIV or STI, right? But also, in addition, we provide case consultation, training, and technical assistance to providers within the state of Massachusetts about CDC guidelines on how to treat, prevent, and control these diseases, right? So the communities we advocate for, primarily for me, are communities that are disproportionately affected by the HIV epidemic. Okay. And we're looking at the Black community, right? Ethnic women, Black women, gay men, Black gay men, Latinx. I'm talking about gay Latinx, right? So these are individuals who are disproportionately impacted by HIV. And what can we do based on the data we have right now? What can we do to reverse that trend, right? Is there any barriers, or are there challenges that is impacting or making these communities not have access to care? And the more we kind of unpeel those layers, we realize there are so many things, you know, to unveil here, which you know, we call social determinants of health. Mm-hmm. Like, how are we able to address those issues to make sure that these communities understand what this is, understand how to prevent it, understand how to control it, and also understand that, hey, let's work together to kind of break down all the mistrust, you know, that exists between these communities and the government, these communities and healthcare providers, cultural traditional norms that we see around. What can we do to kind of, you know, and that led to us start having conversations with the communities, right? So because it's one thing to have an idea, it's another thing to invite the communities impacted to the table, because we want to give them a voice. And that is one beautiful thing about public health. Public health creates that avenue where the care, what you're doing is by the community for the community, right? If you're thinking about ways to prevent HIV in Black gay men in the US, let's have conversation with gay men in the US, right? Or that community that is heavily impacted, invite them to the table and then use whatever recommendations they give you to structure your strategies. That is the most effective. So the communities I advocate for are communities who are underserved, communities who have been marginalized, especially through the lens of HIV infection. Mm-hmm. And we are there, but we're not there yet.
Yes, I can imagine. You know, my story I shared earlier was when I was working in HIV/AIDS in Nigeria. But when I came to the US, I also worked in the HIV/AIDS field before I transitioned to another field. And I remember at that time, I think one of the studies that came out was they're seeing an increase in HIV/AIDS infection among women over the age of 50. And I think that study was in Florida at that time. You know, and it was very interesting because the MD person will be in the hospital. Yes, somebody can come and get tested and they can do the treatment, but they're not studying the trend.
Absolutely.
They're not studying the demographics of who's getting this and all. And so it's the public health practitioner, the epidemiologist who's looking at this trend, as social researchers who is saying, hey, this infection is rising amongst women over the age of 50.
Right.
They went and did the study and then found out, like you're talking and saying, oh my goodness, somebody had overlooked these populations thinking that they're not sexually active. So while we were promoting the use of condom as, a preventive measure for HIV/AIDS, that population had not been targeted. So how do you target a population that you think is not sexually active? You wait until you see the demographics. But if we had just left it entirely up to the doctors who were treating them, the doctors would just be waiting for these people to come and give them the medication to go home. But it was the work of the public health practitioner who said, hey, this is the population that we need to target. And speaking again, what you talked about, the social determinants of health. Yes, when I was coordinating the Staten Island HIV Care Network, looking at all those determinants and say, are we providing housing for our population? Because if we don't provide housing for them and we're giving them drugs, how can they keep to their drug regimen if they're on the streets? Yes. How can they practice safe behavior if they're on the street, if they are not housed? We're looking at the nutrition that we're providing for them. Are we providing food for them that is healthy to build up their immune system? So, but your doctor in the hospital is just like, okay, what's your CD4 count level and all of that, give your medication and goes. And he doesn't know whether you're living on the streets, whether you can take your medication, whether you can eat, or all of those things for social determinants.
Absolutely. I mean, I think you're right on point with that argument, because I think that's what we see today. As a clinical provider, you see a patient. First of all, you don't even have time. You have less than 20 minutes to a patient. All you're doing is to diagnose, is to treat, and to send them their way. And now this has to be the job of someone to kind of take a look at what is going on, who are coming in, who are leaving. What symptoms and signs are they presenting? Where are they coming from? Who are they? To kind of put that into perspective. And that is what epidemiology is, really, is about the study and analysis of patterns and distributions and determinants of diseases in a given community or in a population, right? And that is what data is all about. So when I say public health is the bedrock of clinical medicine, that is not a lie, and when we use those data we get and we translate them into action, and action translates into policies, right? And policies make us, better people. We are safer, we are healthier because of policies and protocols in place. Yeah, so I mean, you're right. I think I want people to start seeing public health as a fast-growing field of medicine that is really taking over. We saw that with COVID-19 pandemic. And now we're sitting back, we are thinking, COVID-19 happened. When are we expecting the next pandemic? How do we have conversations to prevent future pandemics? And you cannot be thinking or having those conversations if you're not looking at the trends for emerging and reimagined diseases. How do we strategically position ourselves so that we take away from the lessons we learned from COVID-19, from monkeypox, to make sure that doesn't happen in the future? That is what public health is.
Awesome. One of the things that I struggled with during the pandemic was, the lack of awareness about public health practitioners in a community. People were like, who are you? Why are you telling us to social distance? Why are you telling us to wear face masks? Why are you telling us all of those things? I'm like, we are the ones who told you about seatbelts, you wear them. We're the ones who told you about nutritional facts on your food, you check the stuff. We're the ones who told you about
right.
It's because of us you have smoking session, no smoking sessions, you have.
I know.
We have been a part of your life all this while, and you have been working and benefiting from the work of public health practitioners. There are so many points in which you can fix yourself in public health. You don't have to be an epidemiologist if you want to be an advocate. You can be a health educator. You can be a biostatistician. You can be a nutritionist. And you're doing one of those things. You're also a faculty in a college. Can you tell me about that?
Yes, I am. I am a faculty now at MassBay Community College. And this is a role that is very dear to me because, just like we're having this conversation, my role now as a faculty is to start in introducing the concept of public health and different aspects of health sciences to these young students who are interested in medicine, but they still haven't figured it out yet. Traditionally, when you think about health sciences, you think of medicine and nursing. So my role now is to expose our students to different diverse fields in health sciences that they are never even heard of, not aware of. And public health happens to be one of those areas. And I also teach medical terminology. These are students going to medical school, nursing students. I'm also a career coach where I kind of guide students, provide that guidance and that counseling that they need to kind of figure out what that career path looks for them. Unfortunately, I didn't have that growing up, even though I eventually figured it out on my own, that this is what I needed to be doing. But these days, most kids are not fortunate to be able to be there to guide them, give them perspective, look at their strengths, figure out what they are good at, what they excel at, and kind of determine what that path looks for them. Is very rewarding to see some of my students come back and say, oh my God, I got into nursing school. I think nursing is for me. Oh, I'm going to medical school. Oh, it's pharmacy for me. It just makes it even better.
Awesome. That is so exciting. And we're bringing up the next generation. I know some people have said that we don't do enough advocacy for public health in terms of awareness and, for the young people or for even people who can do career change. And so since you say you're a career coach, what would be your word out there for somebody who hasn't thought about public health, but maybe already has what it takes to be a public health practitioner? What should you be thinking about if you wanted to go into public health?
Yeah, public health, if your mind or if you as a person, you are always about protecting, improving the lives of others, maybe there's a room for you here in public health. And you don't want to go to medical school, it's fine. There's a space for you in public health. I advise students that I say, let's figure out what your strengths are. Where are you good at? What are those things you want to do? Because I don't want my students to just get into a career field because of the pay, because of how much they're going to make at the end of the day. I want them to go into it because of how it aligns with their core values and who they are. I want them to get up every morning and get so excited about going to work, about saving lives. That is what is important to me. And when you do that and do that right, the money will come. Right. So when I coach my student, that's where I start. I'm not looking at about, financially, it's okay to look at how much, you get at the end of the year, but there's a bigger picture here for my students. I really want them to do what makes them happy. And that's where we start from. What makes you happy? We figure that out. What are your core values? What are the things that if I ask someone who knows you very well and I say, what does this person stand for? What would they say? And then we piece those things together. And then it comes down to what are the classes you enjoy. Because we want to make sure that even though you're excited about these areas that you want to go into, that the classes you're taking, you're excelling in as well, right? I wouldn't want you to think of, I want to do nursing, but you're not very good in biology or chemistry. That is not ideal. Let's take a step back to figure out where you fit in. So having those conversations and figuring out their classes really sets the tone about what their career path is for them. And I tell them, it's okay if you can't figure it out now. It's fine. I didn't figure mine out until end of medical school that I wanted to do public health. It's okay if you don't know what that looks like right now. So let's start from where we are. Where do you see yourself in the next 5-10 years? And we begin to build from there. And that is what I see as career coaching. Career coaching for me has to be focused, has to be intentional, has to be trauma-informed, has to be individualized, has to be cultural and linguistic appropriate, has to be evidence-based, right? Just making sure that it's tailored to each of the students because it cannot be the same for two students. Right.
Awesome. So in case you didn't notice, you just got an extra career coaching tips on meeting your public health professional on this program. If you're just joining us, I'm Dr. Lillian Agbeyegbe, your friendly community health educator. This is your public health professional and you, a program of the Maryland Public Health Association. And I'm talking to my first MD, MPH guest, Dr. Ugo. Ugo, as we round up this program, when you give you opportunity to share anything that you'd like to share with the audience that I haven't gotten to, that you think people should know about public health, about the remarkable work you're doing in our community.
Yeah, no, if you're interested in public health, take a look, do your research. Public health is a growing field of health sciences, and there are so many aspects of public health you can go into. I think you alluded to that, Dr. Lillian. There's epidemiology, there's biostatistics, there's occupational health, there's environmental health, there's maternal and child health, there's health education. There's so many fields of public health you can get into. You just have to figure out what fits well for you. And so my advice is do your research, figure out what that career path looks like, and find a mentor. Like I mean, the importance of having a mentor in this field is great. Look around you. Is there anyone you see around you who you want to be in the future? I think for me, I've always looked up to my mentor now. And eventually when I reached out to her and I'm like, oh, would you mind being my mentor? And she was like, yes. And we were like just a perfect fit. And she has helped guide or transform my career to where I am now. So mentorship is key. And you talk about my role at MassBay Community College now as a professor. One of the reasons why I took on that role is, the statistics of students who go to MassBay, who go to community colleges. These are underserved students who have been through the ringer. And who are those students? Students like me, students of color. I was able to, I accepted the job so that they can see that it's okay to look like this and still be successful in this field. If they can see me do these things, they can be me. So this idea that representation is key. So we need to pay it forward. We need to foster it within our communities to know that there's a room for all of us. It doesn't matter what you look like. It doesn't matter where you come from. It doesn't matter your tongue, your language. It doesn't matter your sexual orientation, your gender identity. It doesn't matter your political beliefs. It doesn't really matter. What matters is what you set your mind to do. If you want to be it, you can be that person. So really being out there, being such an inspiration to these young bright minds who are still figuring it out is something I'm just very proud of in doing.
I'm so excited and I'm so glad that you can join us. I'm not going to let you go without talking about your CPH, because in a couple of days, I'm going to be teaching one of the CPA prep classes. So you are certified in public health. Tell me about that and how helpful is that to our work as public health practitioners?
Oh, it changes everything. It's a game changer. And the thing is, I think you know this, at the University of North Texas, you have to be certified in public health before you graduate.
That's how I'm certified here.
And I am so happy I went through that program, because I don't think I would have been certified if I didn't go through that program. So that certification is a game changer, because your certification really puts that stamp of validation on the work that you do. It gives you a lot of opportunities to put your work out there. It's like credentialing. Just like an MD, you have to get your certification or you have to get your license to practice. This is like the license to practice public health, right? You're certified. So, but again, you don't have to be certified to do this work. But certification just gives you that extra layer of professionalism, to network, to a lot of access to things that someone who is not certified wouldn't necessarily have. It really opens the door for you. Also, even when you're looking for jobs or looking for partnerships and collaboration, we kind of lead you to the door, but again, you don't need to have it. If you can get it, I will advise getting it, because for me, it really opened a lot of doors for me.
And aside from opening doors, one of the things that the National Board of Public Health Examiners do by having this certification is letting you know that the public health practitioner is staying on top of their work, because we have continuous education hours that you have to go through every year to maintain your certification. So we're staying on top of trends as things are changing and are emerging. I mean, a couple of years ago, I had a guest on the program, I think maybe last 2 episodes or so, and she was talking to me about engaging her constituents through WhatsApp. I was like, WhatsApp? We didn't have that as a communication tool. But as public health practitioners, you begin to know, like you're talking about, engaging your audience and the population that you're working with. And you find out how best the population interacts. And then you have to design your program to meet your audience where they are. You not just have a textbook approach, but really meet your audience where they are. And she was using WhatsApp. Their program used WhatsApp. So that's a MPH is like you have to keep learning and keep evolving as information and technology changes.
No, absolutely. Public health is ever evolving, and that's why you have to be in touch with what is happening. And, this continuous credits, you have to get them in for you to get recertified. But I think it's worth it. It's part of the learning process. And like you said, I love what you said about know your tribe. I think that's what we've been trying to advocate here, even in our work here. Because you have to know the communities you work with. You have to know this population. These are not just numbers or statistics. These are individuals. Get to know them on a personal level. And this is my advice to anyone thinking of coming into public health. Think of a community you identify with. Think of a tribe. Get to know them well. Get to understand what their issues are, what their challenges are, what their problems are, and put yourself in the driving seat to help develop ideas or strategies or ways to help solve their problems. That is just public health in a nutshell.
Awesome. Thank you so very much. This has been a very exciting conversation. We could go on forever.
I know.
So many firsts for me on this episode. My first MD, MPH guest, my first person who went to school together. We both went to University of North Texas Health Science Center. My first home person. We're both Nigerian Americans,
I know.
And so we're really very excited to bring to you this episode of Your Public Health Professional and You, a program of the Maryland Public Health Association. Ugo, any last words before we sign out?
Oh, no, thank you so much for having me. I think your platform is great. My wish for you is that it continues to grow. I see the impact that you're making. I want you to know that we see you. I want you to know that we recognize your voice. I want you to know that we appreciate you. So continue this work in public health, and hopefully we get to make the world a better place.
I would say an amen to that. Thank you so much for joining us. You can find us on the web, Maryland Public Health Association, that's NBPHE.org. You can watch our previous episodes. Find us. We have a YouTube channel as well, NBPHE.org. You can find our YouTube channel. You want to contact us, get info at NBPHE.org. I'll come your way again another time. Until then, this is Dr. Lillian Agbeyegbe, your friendly community health educator. Thank you, Dr. Ugo, for joining us. And we'll be back with another guest next time. Thank you.